Hello and welcome back to Introduction to Pharmacology. Before we proceed any further, let us briefly recapitulate what happened or what we discussed in part 1. So we have discussed so far that before we can prescribe any medication to any patient in front of us, we must first understand the problem, the clinical problem with which the patient presents. So we should be able to diagnose it and of course know the cause of these problems, the pathophysiology and etiopathology of that clinical condition. This will help us to understand what are the possible ways of correcting the problem. That is, what are the possible solutions. The knowledge whether drugs can help us solve this problem would be given by the understanding the pharmacodynamics of all the drugs that are available. That is, are there any drugs capable of correcting this problem, and are there any drugs effective and safe enough to be used in a patient. Having identified these drugs, we must know which of them is most suitable for the patient in front of us in terms of both efficacy and safety. Next, we must know how do we administer these drugs. What's the route of administration, the dose, the dosage schedule, and the duration of treatment. So this would be available to us. This information would be available to us if we know the kinetics, pharmacokinetics of the drug chosen. Thus, in short, pharmacotherapy, that is, use of drugs to treat any clinical condition, depends on the sound knowledge of pharmacokinetics, that is, movement of the drug in the body, and pharmacodynamics, what all the drugs can do to the body. And both of these, kinetics and dynamics, are governed by some general principles, the general rules of the body, which we must know, and that kinetics, we also saw that kinetics decides the dynamics, because unless the drug is able to reach its site of action, it cannot show us the desired effects. So dopamine is useless to Parkinsonism patient, even if you give it intravenously, because it just does not reach the site where dopamine deficiency is to be replenished. Understanding this common principles which govern kinetics and dynamics will now be our task today, because we will try to study some more details of these general concepts and derive the most important property of a drug, or any drug for that matter, which decides its both kinetics and therefore also dynamics. We will also try to understand why this particular property or attribute of a drug is so crucial and what are the clinical implications of a drug having that attribute or not. So let's go on to again see the details of pharmacokinetics, which is the movement of the drug in the body from administration to elimination. Kinetics is movement. That's an easy way to remember what is kinetics, pharmacokinetics, and what is pharmacodynamics. So this movement we could break up into 4 stages. One is absorption, that is entry into systemic circulation from whatever be the site of administration. Next is distribution. Why are we interested in the drug getting absorbed or entered into systemic circulation is because once it enters the systemic circulation, it will be able to go to its site of action. But the site of action need not necessarily be, or very rarely is, just being in the systemic circulation. So a drug has to leave the systemic circulation to reach its site of action. And this is considered as distribution of drugs. After the drug reaches its site of action and does whatever we want it to do, we want the drug to be eliminated, and body wants it to be eliminated. And therefore, it undergoes biotransformation and excretion, or one of the two, depending on the properties of the drug. And these are the 2 steps involved in drug elimination. So all this happens according to body rules, and therefore we also talk about pharmacokinetics as what body does to the drugs. Let's see the details of these individual steps of pharmacokinetics. Of course, please bear in mind that though we have numbered them as 1, 2, 3, 4, it's not that first all drug will get absorbed, then distributed, then undergo biotransformation or excretion, because the moment drug enters the body, all these other processes also start. So coming back to absorption, which is entry into systemic circulation from whatever be the site of administration. It could be an injection, it could be orally ingested drug, or even applied on the skin. From whatever is the site of administration, entry into systemic circulation is called absorption. And for getting absorbed, the drug has to cross biological membranes. So it involves crossing biological membranes, and crossing of biological membranes, by virtue of the nature of these biological membranes, the cell membrane for example, this is most easy for lipid-soluble drugs. Lipid-soluble drugs can easily cross biological membranes and therefore, for example, if ingested, can enter into systemic circulation, or even if injected elsewhere, can enter into systemic circulation. Next comes distribution, which is passage of drugs from systemic circulation to other fluid compartments, because somewhere there is the site of action. For example, what are these other fluid compartments? Interstitial fluid compartment is the fluid around the cells. We could equate it with extracellular fluid around the cells. Another fluid compartment is inside the cells, that is intracellular fluid compartment. And what is transcellular? It is the fluid within body cavities, like say for example CSF in the ventricles or aqueous humor in our eyes, the fluid in body cavities. Again, entry into interstitial fluid is possible by leaving through the capillary gaps, which does not require lipid solubility, but entry into the cells, inside the cells, or into these special body cavities like CSF or aqueous humor requires lipid solubility. It is more easy for lipid-soluble drugs to enter into the CSF, cross the blood-brain barrier as we discussed, or enter inside the cells. So again, lipid solubility is the deciding factor for proper or complete distribution throughout the body. Then comes excretion, as we in our points of discussion. Though, as I said, excretion starts the minute a drug enters the body. It doesn't wait for entire drug to be absorbed, to be distributed, and then the process of elimination does not start. It starts the moment drug enters the body. So excretion is the final elimination from the body. Again, the quantitatively most important mode of this elimination is through urine. So let's first consider how this urine is formed. Here you see the picture of a renal tubule, which consists of the glomerulus with big gaps where glomerular filtration happens. So composition of urine, what actually will go out through urine, depends on this glomerular filtration. Some substances are capable of getting actively secreted into the renal tubule, which is called tubular secretion, and out of this, whatever is taken back, tubular reabsorption, would be removed from this filtrate and rest of it would pass out as urine. By the way, what all is filtered in the glomerulus? Or maybe it is easier to enumerate what is not filtered, because glomerular filtration depends on particle size. It does not depend on lipid solubility. So whatever is small enough will get filtered at the glomerulus. So as I said, it's easier to enumerate what is not filtered. What is not filtered? Only the blood cells and bulky plasma proteins. Rest, everything is getting filtered. And can we just throw it all out? No. And therefore, 99% of the filtrate is getting reabsorbed. Please remember, 99% of the filtrate is getting reabsorbed. We'll come to it subsequently. Tubular secretion is an active transport mechanism which is available only for a few selected drugs who can use it. So we discussed the mode of entry into the renal tubule is glomerular filtration and active tubular secretion. Mainly it is glomerular filtration. For getting removed from this filtrate, we discussed 99% of filtrate is reabsorbed. 98% occurs by passive diffusion, just diffusing back across the walls of the renal tubule into the circulation. And this again is possible only for lipid-soluble drugs. Lipid-insoluble drugs, once filtered, cannot come back. They have to leave through the urine. But lipid-soluble drugs, even if filtered, keep getting reabsorbed. Is that clear? And therefore, how does body get rid of these lipid-soluble drugs? If they're going to be filtered and again reabsorbed, body has to convert them into lipid insoluble form. And this conversion into lipid insoluble form is called biotransformation. Major site of biotransformation is liver. So biotransformation is the chemical alteration, chemical transformation of the drug in the body to convert lipid soluble drug into lipid insoluble metabolite. Why? To prevent renal tubular reabsorption and thereby facilitate excretion. So lipid soluble drugs which the kidney cannot remove effectively, because even if filtered, they keep getting back, they keep getting reabsorbed, is converted by the process of biotransformation into lipid insoluble metabolites which will not get reabsorbed. They have to leave once filtered. And therefore, this is called biotransformation, lipid soluble to lipid insoluble, that is excretable form of the drug. So purpose of biotransformation is to help excretion by converting lipid soluble drugs into lipid insoluble metabolites. So now we can actually define excretion in its proper perspective. It is the final elimination of the drug or its metabolite from the body. Major mode, as we said, is through urine. So by now, you must have identified the most important property of the drug which decides its kinetics, the movement in the body, therefore also its dynamics, its ability to reach the site of action, and also body's process of eliminating the drugs. And the common attribute is lipid solubility, the most important property which decides kinetics and dynamics of any drug is its lipid solubility. So what are the clinical implications of lipid solubility? Only lipid soluble drugs can diffuse across biological membranes, and therefore only lipid soluble drugs are well absorbed on oral administration. They can cross the cornea into the aqueous humor. They can cross the blood-brain barrier into the CSF and have actions inside the eyes or inside the brain. They cannot be eliminated by kidneys. They may get filtered, but they are getting reabsorbed. And therefore, they need to undergo biotransformation. They need to undergo biotransformation for being eliminated. And as we saw, biotransformation is conversion of lipid-soluble drug into lipid insoluble or excretable metabolites. Thus, if you understand whether a drug is lipid soluble or not, you know so much about that drug. You know that if it is not lipid soluble, it may not be available for oral administration. Because it cannot cross the biological membranes, it may not get absorbed. Example is gentamicin. You have to inject it. If it is lipid soluble, it would be available by oral administration. It can cross the cornea, so you can have pilocarpine eye drops to go inside the eyes and work. You can have drugs like levodopa, which can cross the blood-brain barrier. And we have drugs like carbidopa, which cannot, because one is lipid soluble, the other is not. And this also decides the process of elimination, which applies to that drug. For example, if you have given gentamicin and glomerular filtration is less or not normal, gentamicin will accumulate and further cause toxicity. Whereas for lipid-soluble drugs, liver function has to be proper so that the drug does not accumulate and cause a problem. So have you discussed or have you understood that lipid solubility decides kinetics, lipid solubility decides dynamics of the drug by deciding whether it will reach the site of action or not, and it also decides the toxicity of the drug, particularly in patients with compromised renal or liver failure. So this is the most important attribute of a drug, which decides its kinetics, dynamics, and safety profile as well, and the precautions we may need to take while giving it or considering its suitability for a particular patient in front of us. Thank you. If you've liked this, please let us know that you've liked it.